Coming up today, painful elbows, crippling sore feet and ankles. Sound familiar? Now doctors have a new tool to help make weak tendons strong again. See the procedure where doctors shave away harmful tissue without invasive surgery. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Chronic tendon pain can limit mobility, linger for months, and make everyday activities a challenge. Sometimes rest and rehab are enough, but when the pain keeps coming back, there is a new minimally invasive option that doesn't require surgery. Today, we are explaining how this device, a needle inside a needle, can remove tissue and restore function. But first, let's get to our morning rounds this morning. September is Prostate Cancer Awareness Month. An estimated 1 in 8 men will get it in their lifetime, making it the second most common cancer among men behind skin cancer. The good news is it's highly treatable, even curable, when caught early. This morning, we are talking with Dr. Will Parker, urologic oncologist here at the University of Kansas Cancer Center. He treats prostate cancer and only prostate cancer. Always great to have you here with us. Good morning.
Good morning. Thanks for having me.
Yes, good to have you. Okay, so we're going to be meeting a couple of your patients later on this month. But start us off with the basics. What is the prostate? What is its function?
Sure. So the prostate is a reproductive organ. It's in the lower pelvis. It's involved in production of things that help with, again, reproduction, with making sperm work the way it's supposed to. That's what it is and where it is.
So why is prostate cancer so common?
So we don't fully know all the things that cause prostate cancer. However, there are a number of genetic associations that cause prostate cancer and allow it to become evident in men. It is incredibly common, 1 in 8 men.
We know early detection is key with all cancers, and screening guidelines seem to change now and again. But what are the best screening guidelines?
So ideally in average risk men, you should begin screening at 45. That's with a PSA, so a blood test, and ideally a digital rectal exam, so feeling the prostate to ensure there are no lumps or nodules. However, in men who are high risk, so black men, men who have a strong family history of prostate cancer, but also other cancers like breast, colon, ovarian, they need to begin at 40. So that's the up-to-date screening guidelines.
A lot of treatment options that we've talked about. Sometimes the best, though, is to delay treatment. Can you explain when that kind of wait and see approach makes the most sense?
Sure. So prostate cancer is a spectrum cancer. So it exists on a continuum. There are cancers that are lower grade and less aggressive. And in those men, the wait and see approach is very appropriate because it's unlikely their cancer would ever harm them. However, as it becomes more aggressive, then we need to start doing more invasive treatments like surgery or radiation. So
we'll discuss radiation and surgery in depth a little bit later on this month, but what are the biggest pros and cons for those two treatment paths?
So first and foremost, it's important to recognize that both treatments are highly effective. So the pro is they both work really well. The downsides are, unfortunately, everything we do in medicine carries some side effect or some risk, and so both treatments carry side effects that affect quality of life. And I know we're going to talk a lot about that later in the month, but things like urinary control, sexual function are issues at play here.
Well, we look forward to meeting your patients and seeing you again later on this month. Dr. Parker, always great to have you. Have a great one.
Great being here. Thanks.
Thanks. At the desk with us today, we are speaking with Kirby Dodd, who recently had work done on the tendons in her hip. A pain management specialist, Dr. Usman Latif, performed that procedure. He's going to join us here in just a moment. But it's not just pain management doctors using this device. Dr. J.P. Darsh, a family medicine and sports medicine specialist, is using TendoNova to treat tendon pain. Good morning to both of you. Always good to see you. Good morning. Kirby, good to have you with us. Dr. Darsh invited us into his clinic space to kind of show and tell. Always good to get in there with you. You're going to show us kind of how this device works, and you use this to help his patients get relief from Achilles tendon pain. And just kind of a heads up, of course, this is a medical procedure, so there is a little bit of blood. Take a look.
First thing we'll do is I'll start by finding the area.
Basically, the concept is
using the ultrasound to guide you, we go and break up the scar tissue and cause a little bit of bleeding. So it brings like the healthy new bleeding that helps your body heal itself, and also kind of breaks up all that scar tissue that's built up over years. I'm just kind of disinfecting everything. The last thing we need is an infection.
I stepped in a little hole and messed up my Achilles and tried to do therapy on it first, try to rehab it, and it just didn't work out.
Feel that little sting here? I'm doing great.
Other than a little bit of a sting as they were doing the numbing, like a little bee sting, other than that, it didn't feel anything.
Once you're numbed up, it's about 5 minutes. I can see the Achilles that looks unhealthy, and I can see my needle, and I can see where I bring it. Instead of guessing, you know exactly where the needle is. There's no guessing involved. You will see some bleeding because that's what we're causing. We're causing a little bleeding. Some people, especially if they're on like a baby aspirin every day, it'll bleed more. And I look at it as it's okay. It's completely normal. It means the blood's getting there. We're going to have good healing, good growth factors in there to allow the tendon to heal. All right, I think I'm going to hit my last spot here.
Seems like a great approach because he can actually see inside what he's doing without opening it up, and he was able to break up all the scar tissue. He said there was more than normal, but he felt really confident about it, and so if he feels confident, so do I.
That is it. We didn't beat you up too bad, huh?
Thank you guys so much.
Oh, look at you.
And he is on his way. So, Dr. Darsh, what is a tendon, and which tendons normally cause the most problems?
So tendons are basically, really simplistically, is the end of the muscle, right? So the part of your muscle that attaches to the bone. So it's meant to be, it's obviously smaller than the actual muscle, but it's meant to be very resistant, can handle a lot of load. And people tend to have, you know, with overuse injuries, or even when you load it repetitively, they're very prone to having injury, having pain there. You'll hear if you're, you know, for example, Achilles tendon, if anybody's sports fans, you'll hear your favorite athlete might have had an Achilles rupture, and that's, you know, as you know, it's a devastating injury. They miss many, many months. But there's also more like overuse, you know, weekend warrior or anybody that's runners or weightlifters or even everyday activities, working around the yard. People can get overuse and inflammation, those tendons. And, you know, the common ones would be the Achilles tendon. Then at the knee, you have the patellar tendon. Also very commonly, we see the elbow tendons, the tennis elbow, golfer's elbow that people might have heard of. And then in the shoulders and hips as well, very, very common to have overuse injury and have kind of chronic pain that sometimes can be very frustrating to treat.
Hello, how are you? Dr. Latif, good to have you.
Yep, good to be here.
So millions of us, as we know, we live with some type of pain. If someone has pain in their ankle, their elbow, their knee, their shoulder, how do you know if it's a tendon problem versus something else?
So a lot of it has to do with the location of the pain. If the pain is over in the middle of the muscle, then it's probably more likely to be a muscle strain or something myofascial. If it's right in the joint itself, then it might be arthritic pain. But as Dr. Darsh mentioned, there's basically a bundle of fibers that connect the muscle to the bone, and usually near the joints. So if the pain is kind of near the joint, but not directly in it, then it's highly likely to be tendon-related pain. And often too, then certain types of repetitive motions or movements will trigger the pain, and that'll be another clue that that's probably a tendon.
And we saw Dr. Darsh working on a patient's Achilles tendon. Kirby, you had this procedure done on your hip. What did your hip pain feel like? How is it impacting your daily life?
The most impact that I had was really sleeping. I was not able to sleep well. It just was aching, sharp, went down my legs all the time. Also just chasing my kids around was more difficult because they're always on the go. It's hard to keep up whenever you're having hip pain that radiates down your legs.
So what type of treatments were you trying before you were offered this treatment?
I did, of course, physical therapy. I did conservative things, ice, heat, things like that. I also got some different, more like trigger point injections. I believe I did a steroid as well, just a small kind of diagnostic.
So you were trying anything and everything to relieve the pain.
Definitely.
Dr. Darsh, there are a few different terms, medical terms that we hear, tendonitis, tendinosis, tendinopathy. What's the preferred term, and what specifically does this procedure treat?
Yeah, so you'll hear these terms like tendonitis is mostly like when it says itis at the end of the word, it means acute inflammation. So that's usually early on in the process. A lot of times you'll be inflamed But we're talking usually swelling, acute pain, just started recently. That's usually more the tendonitis phase. Once you start getting it more chronic, then that's what we call tendinosis, which is not so much inflammation, but it's kind of like chronic inflammation in your body causes kind of scar tissue. The way I explain it to patient is those tendons have fibers are supposed to all work together in sync, and tendinosis, chronic tendinosis causes a lot of deposition of collagen or scar tissue. Okay, so that's why a lot of times people, when they have like Achilles or whatever tendon, they'll be enlarged, right? So you feel your tendon, they'll feel like a big nodule there. That's scar tissue, and it doesn't really allow your tendon to heal well. So with that procedure, what we do is we go and break up that scar tissue. So kind of breaking all these adhesions that's between the fibers, and we're also causing micro trauma, so kind of like a little bit of bleeding, which brings the acute, healthy inflammation that your body needs. And then, the things that you have to do as well, tendons respond really well to getting loaded. So like physical therapy, strengthening is very important. Being overweight is also a risk factor for having more pain. So bringing your weight down, all these kinds of things are important. But historically people have done a lot of, let's say, cortisone injections for this, which if it's an acute tendonitis, it might work because we're dealing with acute inflammation, but cortisone is anti-inflammatory. So when we use this on chronic tendon pain, it might give temporary relief, but it typically doesn't work very well because we're not dealing with inflammation, we're dealing with chronic, unhealthy inflammation, scar tissue. So that's why this is such a great option to go break up that scar tissue and kind of start from fresh.
Dr. Latif, what makes treating tendinopathy so challenging with traditional approaches?
Yeah, so I think one of the things that happens is, tendons get overused, especially with repetitive motion, certain sports, walking around, whatever it might be, and they start to degrade. And they are poorly vascularized. So what that essentially means is you need to get blood flow to that area to bring in healthy building blocks that will help rebuild and heal that tendon. But there's very poor blood flow to that area just because of the way your body is designed. And so it really inhibits that process. So that's one of the first challenges. The second challenge is that when this happens, a lot of time it's because of overuse. So you need to not overuse it, because if you overuse it, it's going to make it worse. But on the other hand, if you don't use it at all, then it doesn't send that tendon any signals that say, hey, let's recruit things here that will help rebuild this and heal this. So really it's kind of this Goldilocks problem where you have to do just enough to trigger that response of healing, but not too much that it makes it worse. And that's incredibly challenging. Even when working with a physical therapist, often doing that rehabilitation can be tough. When you start thinking about other types of treatments like steroid injections, in some people those can be beneficial, but a lot of times they don't lead to durable benefit. And when you think about things like steroids, like surgery, it's much more invasive and there's a much longer rehabilitation type of process.
So when does it make sense to seek a more advanced treatment like TendoNova?
I think when you've exhausted conservative therapy, if you have pain that's been there for more than 3 months, you've tried doing rehabilitation, maybe you've tried an injection to try to see if it gets better, and you've tried making changes and modifications to your activity to not put as much stress on it, and those things are not working, then I think it's an extremely reasonable pathway to go down because it's so minimally invasive, it's very, very low risk, and it's really not that much worse than getting an injection.
Well, let's look at the procedure again. It's not a surgery, so no OR staff. You're using ultrasound. What are we seeing when we look here at the monitor?
So when we're looking at the ultrasound, what tendons look like when they have chronic tendinopathy, and in this case is the Achilles tendon, is that the tendon itself would be much thicker than normal. There will be, if anybody is used to looking at ultrasound, you see calcification, so little bright white spots, which just means that basically your tendons had chronically been inflamed, and then your parts of it become calcified. And then also you'll see kind of areas of scar tissue, which is like a dark spots that we see here and there. So in this case, it's a very, very thickened tendon. He's had pain for a long, long time. And that's exactly what we're doing is you see the needle get in there, and it's trying to just break up the scar tissue, kind of revive the acute inflammation and break up all these adhesions.
And how does that work? It's a needle inside a needle. How is that working? What does that mean?
So the device itself, like you see there, the handheld thing is basically just a battery and a sleeve on top, and then there's a what we call 18 gauge needle, which is basically like a big needle that you would use for an IV. It's not so big that it's that traumatic, but think of roughly kind of like getting an IV, and there's a smaller one inside with a certain pattern to it that goes in and out very fast. I want to say it's 40, 50 times a second, and that's what cuts and debrides the scar tissue.
Kirby, what was this procedure like for you?
It was just mainly the most painful part was the lidocaine to begin with. Other than that, just a little bit of pressure. It was very easy. I've done it twice now on both hips, so it obviously was not bad, or I wouldn't have repeated it.
Dr. Latif, then how does treating the hip area compare to what we saw Dr. Darsh doing there on the ankle of that patient?
Yeah, so I mean, I think fundamentally it's pretty much the same concept. We're just working in a different area. So in the hip, the most common tendon that we'll treat is often the gluteus medius tendon. So we're just basically making several passes across that area, trying to break up the unhealthy tissue and stimulate an inflammatory response so that new building blocks will come to that area and help that heal. The other area that we'll usually treat around the hip is the bursa. So a bursa is like a lining usually over some type of bony surface. So in the hip, the greater trochanter is kind of bony, and there's a surface over it called the bursa, and that can become inflamed, and that's pretty common. And so we can also treat that with this procedure where we'll basically run back and forth across that area, look for those areas where it's calcified or thickened or unhealthy, and help break those up so we can also stimulate healing at the bursa area.
If you are watching us live, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email those questions to the Medical News Network. That information is right there on your screen. Kirby, what was recovery like? Did you have to use a wheelchair, crutches?
Just a cane on the opposite side of the hip that you have done. Just the first day you kind of take it easy.
About how long?
So I would say it's 6 weeks of using the cane. The first 5 days are uncomfortable, definitely not painful. But other than that, it's been pretty smooth.
And you felt pretty good getting back to because you got these little kids. You got 3 little ones at home, outnumbered at home.
Absolutely.
And that was your goal, is to get back to the kids. Able to keep up with them a little bit better now, I take it.
Yes, for sure.
What has that been like? And what has that meant to you, though, just as a mother, to be able to mom again the way that you wanted to? Talk to us a little bit about
absolutely. Because my kids are very active, and being held back is really hard as a mom. So being able to get back in there and play sports and just be present has really changed my life.
Dr. Latif, I'm sure it's very rewarding to sit with your patients and knowing that you're getting them back to what many of us take for granted, which is just getting up and being able to do the basics in life, work and be a parent.
Yeah, no, absolutely. I think that's why we do it. I think a lot of times we focus on so many things, especially when you look at research, things like how much did the pain improve, what was the % improvement, things like that. I don't think at the end of the day any of that matters. What really matters is functional improvement. Everybody has certain things in life that they want to be able to do with their family, with their friends, and that matters to me much more than a pain score or any other type of metric. Is, are you happy? Are you able to do the things that you want to do? Do you feel like you're getting back to normal function? If we've accomplished that, I don't really care as much about the pain score. I care about your life.
Dr. Darsh, what do you hear from your patients?
Exact same. I second that. I mean, the important part is people, they have certain things they like to be doing. For some people, it could be go running a marathon. For others, it could be just being able to, walk around with their grandchildren, or be able to just do basic tasks around the house. And it means a lot to people. And chronic tendon pain can be very frustrating and difficult to treat. So, and that's just one of the great tool that we have that for the chronic ones that don't heal, that we've seen a lot of success with.
And I like what you said, whether it be just getting around with your grandchildren or running a marathon, it's just what it means to each individual patient. Dr. Latif, what is a typical recovery timeline? Obviously, it's different from patient to patient, but what could be typical?
Yeah, it varies. So, like Kirby mentioned, it takes about, it can take up to 3 months actually to get full benefit from the procedure, but I would say most people within even just a few weeks will start to feel much better. In terms of the procedure itself, I have people where maybe they're just sore for a couple hours and then that's it, and then they're just kind of back to their normal life. And other times it can last, maybe up to 5 days. I'd say Kirby was probably on the higher end of that. Most of my patients, just within after a day or two, they're already like, all right, I'm just pretty much back to normal, and I'm just waiting for it to work. But I think that's just individual variability based on how much inflammation you get and how sensitive kind of everything is. But I'd say it's pretty quick recovery. And I think the biggest thing is it's a quick outpatient procedure. I mean, it takes like 10-15 minutes. You go home with a Band-Aid, you walk out of there. So you can do most activities right away.
Dr. Darsh, what about rehab or physical therapy after?
I think most people, you know, if they're able to do it, doing physical therapy is very important, especially the more active people are. So a lot of times I'll do, let's say, high school, college athletes or professional athletes even, and they have high demands of their tendon. So obviously they're going to do that. But for the average person, usually I try to have them do physical therapy. And every tendon, every injury, for example, the lower body, so the Achilles, the hip, it's a little, recovery might be a little bit longer, because I always tell my patients, you know, when I compare it to, let's say, the elbow, is that we don't walk on our hands, at least I don't. So you don't have to load it every single day. With the elbow, it's much easier to let it rest, let it recover, whereas the hip and the ankle, it takes a little more time. You need a little more, usually needs some therapy to strengthen it, so you get, because we've done one part, the part is to break it up, do the physiological part, and then the last part is, it's kind of like when you have a surgery, you have to do the other part, which is strengthening the muscles around.
How new is TendoNova?
I think if we think about TendoNova, just a certain product, I think it's better to think about the entire category. Really, the category is percutaneous tenotomy, and so essentially coming up with a way to treat the tendons without having to make an open incision, and that's been around for a long time. I think what's happened is over the last couple decades, more and more companies have kind of come to this area and come up with new innovations. You know, maybe we're using ultrasonic waves to break things up. Maybe we're using Venturi effect from saline running through an open space in a needle. Or maybe we're using direct mechanical stimulation, which is what is being done with TendoNova. I think the biggest innovation that came with TendoNova is just that it is probably the most minimally invasive option that we have so far, because the ones before it, which are also very good, did still require a small incision and a much bigger setup. And with TendoNova, I mean, you literally don't have to make an incision. It's just a needle puncture, and we can do it right in our clinic, and it's just all handheld. Everything's disposable. So I think that that has really made it much, much more convenient, not only for clinical practices, but for patients.
What's the typical patient population? Is it older adults, people with physical jobs, athletes, all of the above?
I think I see it all. Athletes to sedentary people to very active, let's say, construction worker, to have the elbow, like tennis elbow type picture. You really see it's extremely common. I mean, if anybody's watching out there, most people have had issues with tendon pain at some point in their life. But most people are able to recover without having a procedure, but there's a significant amount of people that require a little bit more.
Why is it that doctors from two different specialties are doing the same procedure? Is that pretty typical?
Sure. I think so. I think we both treat people that have pain, right? So
yeah.
Muscle injuries, and it's an excellent procedure that's available. So I think we both like to try to make people feel better.
Yeah, I think if you look within medicine, there's a lot of different things where there's overlap, right? Specialties are not just like perfectly fenced off. There's some things you see the interventional cardiologist, some things you might see the cardiothoracic surgeon, and so in the same way, I think there's a little bit of overlap here. I think at the end of the day, what really matters is just as long as we have qualified people doing these procedures, then we are expanding the access for patients, and so we're able to get treatment to more patients more easily, and I think that's all that matters at the end of the day.
All right, let's get to some questions from our viewers. And Stuart wants to know, what caused Kirby's hip pain? Was it overuse?
We don't really know. I do have a chronic pain condition, so that's a factor. I do get inflamed very easily, but as far as the direct cause, I don't think we'll ever really know.
Yeah, I think that, sometimes, like, for example, people come with like tennis elbow or golfer's elbow or things like that, and then you're like, oh, okay, that's probably what it was. It's just overuse, and it might have been from that sport, or it might have been from something else. But there's other, parts of your body you just use all the time. I mean, you're using your hips every day. You're walking around, you're chasing after kids, doing all the normal things. And so I think a very large percentage of the time when people come in with bursitis of the hip or tendonitis at the hip, a lot of times there isn't a specific cause that we can come up with. It's just life.
Just life. Jeremy says it looked like this procedure was being done in an office. Does that mean it's pretty quick? I think you mentioned it was in and out pretty quickly. And does insurance usually cover it? Yeah,
so I can answer both of those things. So in terms of the time of the procedure, it's pretty quick. You can drive yourself here, you drive yourself home, you don't have to fast, you don't have to get an IV. Probably just the setup, like just once you kind of lay down and we start just opening up everything, that might take 5 or 10 minutes. But the procedure itself, once we get started, I mean, it could be quick as 3 to 5 minutes. It's a very, very speedy procedure, even if you're really taking your time to kind of do a diligent job there. So yeah, it's very quick. In terms of insurance coverage, for the most part, we find that there's pretty pretty good coverage for the procedure. And within the health system, for the most part, we try to focus on offering things that will be covered by insurance because we don't want to create a burden for our patients. But generally, I haven't really had too much of an issue of getting approval for this because I think it's just such a accepted therapy.
Lynn asks, are there any restrictions with this new treatment? For example, if the shoulder or joint has been stiff for a long time, would it still be suitable? Also, after the treatment, would exercising a bit earlier to keep the joint warm and the blood flowing help speed up recovery and improve the results?
I think that all depends on the condition, right? If this person says the joint has been stiff, I think first things first is to be diagnosed appropriately. You know, is that really a tendon issue, or is this something different like arthritis or frozen shoulder or a bunch of different conditions? Once you really have the diagnosis that it is tendon pain, usually if it's been chronic, you've tried other things, it's an appropriate treatment. And as far as exercising early after, I always encourage my patients to keep moving. The biggest thing is not do something that really flares it up because then it might delay the recovery.
Last question's from Jean. Is this treatment permanently curative, or is regular repetition required? I know you had mentioned, Kirby, you had done it twice. What's pretty typical there?
Yeah, so in Kirby's case, she had it done twice because we were treating different sides. So often if patients will come in and they say, hey, you know, both my hips hurt, or, you know, it's both my Achilles tendons, or whatever it may be. And so typically what I'll say is, okay, let's pick the side that is a little bit worse. We'll start with that one. Let's get that treated. I don't want you to be trying to have restrictions on both sides at the same time. That would be tough. But also then you get to have a good sense of what it's like and how much it helps you. And if you feel like it helped you a lot, then we'll move on to the other side. And that's exactly what happened in Kirby's case. We treated the right side, then we went back and treated the left side because she was satisfied with the relief. And I think you had said you got almost like maybe 80% relief on one side. And so then she said, okay, you know, that motivates me to get the other side treated. In terms of like repeats, our goal with this is to give you durable benefits, right? So ideally we want to treat it and then you just get better, and that's the end of that. And especially if you then do things to kind of strengthen that area, avoid repetitive activities that could potentially exacerbate it, then hopefully you'll have that good kind of long-term outcome. But every once in a while we have people where just, you know, they have a great result, and then we go a couple years out and it starts to kind of creep up on them again, and we've repeated it and had good results again.
Dr. Latif, what's the big takeaway today for those watching and listening?
Yeah. So I think, you know, my takeaway would be not just specifically about this procedure, but about chronic pain in general. It's such a huge burden on people, and it's a really difficult condition to treat. But we're also kind of in a golden age right now of innovation where there's so many new treatments coming out all the time. And so what I would say is, you know, keep your hope. Even if you have tried to treat something and not really made progress in the past, come and see us. Let's try to come and chart a path forward so you can regain your life and start doing the things that you enjoy in life again.
Kirby, what's the big takeaway today?
I definitely second that. Having a conservative procedure that really has given me part of my life back has just meant everything to me. Because it is easy to lose hope when you have chronic pain, and this has given me some hope back.
Hope is good. Thank you for sharing your story with us today. Dr. Darsh, what's the big takeaway?
I think I'll kind of summarize everything is if you have especially chronic tendon pain that is frustrating, affects your life, don't suffer in silence. There are options, and like Dr. Latif said, there's more and more good options, and TendoNova is a terrific option, I think. Very quick little procedure that has a very, very high success rate.
Well, it's Red Friday today, Dr.
Yes,
Darsh, but we have you in white.
Yes,
Sorry.
yes,
While
yes.
you, of course, are a team physician for the Kansas City Chiefs, and we can't let you go without just getting your thoughts ahead of the season opener today. And just tell us a little bit about your thoughts about playing in Brazil. Does that change anything, just from a health and safety standard? Just everybody heading out and heading south.
I would say, well, first off, I hope we have a great season again,
Yes.
right? There's only one way to find out how good we are is to play the games.
Right.
And whether it's in Brazil or here or in Los Angeles or whatever, it still comes out to the same football. And, you know, there's been a lot of work that went into going to play in Brazil, both from the league office and from the team medical staff to coordinate everything, make sure everything, all the safety standards that we have with a home game here will be just the same over there in Brazil.
All right. Well, good. Thank you so much for your insight. And we're going to leave you today with a quick look at some of the Red Friday fun happening around the health system. Have a great weekend, everyone.
How about those Chiefs? Go Chiefs!
Let's go, Chiefs! Coming up Monday on the Morning Medical Update. From professional athletes and the fans in the stands to high school players and those on the sidelines, they all have one thing in common here in the Metro: the need for an emergency action plan designated to save lives. I'm Alexis Del Cid. Join us Monday for the Morning Medical Update.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.